9 things that actually reduce chronic pain and symptoms. Most chronic pain and symptoms are neuroplastic, meaning that they're not due to structural damage or disease in the body, and they're occurring due to our brain and nervous system being stuck in a state of danger and survival. And with neuroplastic pain and symptoms, physical treatments will not effectively treat them. What will is taking a brain and nervous system approach of psychological practices and skills. So in this video, I'm going to go through 9 different things that can actually help you reduce your chronic pain and symptoms. Let's dive into it. Number 1, somatic work with pain and symptoms. So many of us, when we have chronic pain, chronic fatigue, chronic dizziness going on, we really view the sensations that are going on inside as very threatening, as very dangerous. But when our symptoms are neuroplastic, there is no damage or disease that's actually triggering the sensations, and the sensations themselves are completely safe. And so we use somatic work, somatically attending to the sensations and creating safety with them to teach our brain that we don't need to fear them anymore. We don't need to worry about them, and we can allow them to occur and stop trying to fight them or control them. I have lots of somatic practices free on this channel. A somatic embodiment practice that I recently did for chronic pain and symptoms, I'll link to the top and put down below. Check that out. We need to start to somatically working with the sensations and teach our brain that they're actually safe. And doing this will help us reduce or eliminate our symptoms. Number 2, processing emotions. Emotions and chronic pain and symptoms, they unfortunately become best friends. Most people have experienced this. They start to feel anger or sadness, and all of a sudden their pain or symptoms increase. So what's happening here is it's not the emotion that's triggering your chronic symptoms, it's how we process it internally. Most of us resist emotions. We push them down, we suppress them. This is what we're kind of taught in our society, and it's making us sick. Because if you resist emotions, you push them down, what'll happen is it will increase the level of danger your brain and nervous system is feeling, and then it's going to actually escalate your pain or physical symptoms. And so somatically learning to process emotions is vital. We need to learn to go into our body, to feel into the emotions, somatically attend to it, experience it, move through it, release it, and express it to others if we need to. And by doing this, it can actually start to reduce or eliminate our chronic symptoms. Now, many of you probably go to see a therapist and the therapist is like, process your emotions. And you're probably like, what the heck does that mean? I know it's complicated. Processing emotions is abstract. So I've made a step-by-step for exploring and releasing emotions. This is the process we use at my clinic and in my digital course. So I'll link that to the top and put it down below. Whether you're new to emotional work or you've been doing it for a while and you feel like it's not going too well, check that video out. It can be really, really helpful in ultimately reducing or eliminating our symptoms. Number 3, reducing fearful or obsessive thinking. A lot of people that have chronic pain, chronic symptoms, have a lot of difficult thoughts taking place all the time. This could be fearful thinking, despairing or hopeless thinking, critical thinking, or obsessive thinking. If we have all these difficult thoughts taking place all the time, and we're constantly in this negative spiral in our brain, it's going to dysregulate your nervous system more and cause your chronic pain and symptoms to increase. The other thing is if we have this fearful thinking, obsessive thinking about our actual pain or symptoms, it will actually start to escalate it even more so. So part of what I teach people is how we can reduce these types of thinking patterns. We need to rewire our brain out of thinking in these ways and to think in more balanced and safe ways. Have safer beliefs, safer thoughts taking place, whether it's about our actual pain sensations, physical sensations, or whether that's just life in general. But by reducing this fearful, obsessive thinking patterns, it can have a real effect on reducing your chronic pain and symptoms. In Pain Reprocessing Therapy, they focus quite a bit on this, on changing our thoughts and beliefs about our pain, about our symptoms, and about our life. And by doing that, we can lower our symptoms. I have a great skill that comes from Pain Reprocessing Therapy called the 3R skill. I have a whole video on it, so I'll link that to the top and put it down below. Check that video out. It can be really, really helpful in starting to rewire your brain out of these negative thinking patterns. Number 4, slowing down and taking the pressure off. For so many people with chronic pain, chronic symptoms, we are living life at light speed, pushing more, being more busy, doing more, and we put all this pressure on ourselves. All of this fast speed life, putting so much pressure on ourselves and then criticizing ourselves for not doing more, it's going to cause your brain and nervous system to constantly be in a state of danger. And so slowing down and taking the pressure off, it's really simple to explain. It's just really hard to do. One of the main reasons I see people's pain take place is because of the amount of pressure and how quick they're going through life. And I spend a lot of time working with people on how they can start to facilitate this. Doing one less thing in a day, slowing down your movement or your speech, even by 5 or 10%, working a little bit less, having more time for joy or connection with others. By doing this, it can help regulate your nervous system and overall actually reduce your chronic pain or symptoms. So play around with this. You'll probably feel that you have this urge to speed up and do more and put all of this pressure on yourself. And we want to catch when that urge is taking place. That urge for urgency is taking place. We want to catch it and then choose to just slow down a little bit. You don't have to go 100 to 0 in terms of speed, but just by 5 or 10%, a little bit slower, a little bit less pressure, it can go a long way. Number 5, regulating the nervous system. For a lot of people who have chronic pain, chronic symptoms, we are constantly dysregulated. And to be honest, a symptom of a dysregulated nervous system is chronic pain and symptoms. And when I say dysregulated, it means we're in this prolonged state of fight, flight, freeze, or shutdown. Common ways it's talked about in terms of mental health and mental health care is anxiousness, like chronic anxiety or chronic depression. These are signs your nervous system is dysregulated. And to heal our chronic pain and symptoms, we don't need to eliminate, states of fight, flight, freeze, anxiety, depression, shutdown. Like, we don't need to eliminate all these things. We just need to dial them back. Because by regulating our nervous system, by helping us be more often in a state of safety and connection, it can actually start to lower our pain and symptoms. Usually when I'm working with people, these happen together. They happen together. So as someone's anxiety and depression starts to reduce, they start to feel better emotionally in their nervous system, their pain or symptoms start to come down at the same time. They go hand in hand. And so starting to get appropriate mental health care that you need, starting to work with a therapist, starting to use some of the practices on my channel to regulate your nervous system is really essential if we want to eliminate our symptoms. Now, regulating the nervous system, there's a lot of terminology. It can be a bit confusing. So I made a whole video on 7 steps to regulating your nervous system. I'll put it up above and down below. Check that video out. It's one of the more detailed ones I've made on the channel, and it walks you through it step by step, what you need to start doing. Lots of simple tips in that video that you can check out. Number 6, processing trauma. We've known for decades that if you face childhood adversity or trauma in adulthood, you are much more likely to develop chronic pain, chronic fatigue, or other chronic symptoms. One study showed that you're about 2.7 times more likely to have widespread chronic pain, chronic fatigue, IBS symptoms if you faced trauma in the past. And so these are very connected. Even if your chronic pain and symptoms came on 20 years after your initial trauma, it's still, it affects us. Our nervous system remembers that. It keeps us in this heightened state of danger. And so when we have unprocessed trauma, it is without a doubt affecting our chronic pain and symptoms. Now at my clinic, we're only able to work in certain provinces in Canada, but we're very trauma focused. We're very trauma informed in the way that we work with people, because we know that by processing someone's trauma, by helping them move through it, overall it makes us more regulated. Things like anxiety and depression can start to reduce. We're more often in a safe and connected space. And as a result, chronic pain and symptoms start to reduce. I cannot tell you the number of times I've worked with someone who's being very courageous, processing their trauma. And as a result, in the coming weeks or months, their pain levels or symptom levels drop even further as they start to process trauma and overcome it. Now, this is a YouTube channel, so I can't process trauma with people on YouTube. But like I said, my clinic can support you if you're in certain provinces in Canada. And also in my digital course, we outline a whole process for people to kind of process trauma on their own. When you think about trauma, this could be abuse situations from the past. This could be things like car accidents. It can also be, especially for people with chronic pain and symptoms, things like medical trauma or what I call sensitization trauma. So sensitization trauma is the trauma from the onset or progression of your chronic symptoms. We can often have this kind of survival response to them. And all of this needs to be processed. We need to work it through. And I know that's hard work. I'm not going to lie about that. It's difficult stuff to work through, but it can have an impact on our pain or physical symptoms by processing it. Number 7, gradually living life more. Most of us, when we have chronic pain and symptoms, what happens over time is our world and our life gets smaller and smaller and smaller. And you're not to blame for this. This makes sense. We're having such unpleasant sensations inside from our symptoms, and we think all these things are triggering it. So as a human being, what do? You avoid. And this happened when I had chronic pain. By the end, I had this kind of shell of a life where I was barely leaving my apartment. I wasn't going outside. I wasn't spending time with friends. I wasn't doing any hobbies that I wanted to because I was so scared if I did anything that it would worsen my pain and symptoms. But the way we overcome neuroplastic pain and symptoms is we need to start living life. People get this backwards. People think, I need my pain and symptoms to start reducing or to become eliminated, and then I'll live life. But the opposite actually happens. Whereas people slowly open up their world, they start to live a little bit more. Their brain starts to get the message, we're actually okay. And their pain and symptoms can start to come down. We talk a lot about cognitive messages of safety, like telling yourself your evidence for neuroplastic pain, telling yourself why you're actually safe, why your body's not damaged. But these are behavioral messages of safety. As we start to live life, lean into things that we're passionate about, that we're excited about, it starts to teach our brain that we're actually okay, that we're safe to do this. So you want to do this gradually. You don't want to don't go 0 to 100 here. Don't go from doing nothing to doing absolutely everything. That's going to be too overwhelming. You have to do this in a graded way. One thing a task that I often give the clients I work with is, today, do one thing to make your life bigger and your symptoms smaller. Maybe that's calling a friend for 20 minutes. Maybe that's going for a 5-minute walk. Maybe if you can't walk yet, it's just going and sitting on a park bench and being out in nature. Maybe it's going to a coffee shop and starting to work on a passion project. But just do one thing to make your life a little bit bigger and your symptoms a little bit smaller. And if you do this day by day, it really can have a big effect on reducing our chronic pain and symptoms. Number 8, moving our body. As I just explained with living life more, a lot of times when we have chronic pain and symptoms, we stop moving altogether. This makes sense. Movement is deemed as really threatening, as really dangerous. But the thing is if your pain and symptoms are neuroplastic, movement isn't actually triggering anything. The brain's interpreted that moving is actually dangerous, but it's made a misinterpretation because movement isn't actually going to damage your body further or worsen it anymore if your pain and symptoms are neuroplastic. And so as a result, we need to slowly and gradually start moving again. This is a lot of what I work on with people. And when I recovered, I spent months going from basically being bedbound, not really moving at all, almost never leaving my apartment, to gradually starting to walk and to move my arms. And after, it took me about 4 months to get back to fully using my body. But by the end, I was working out, I was doing all of these things. I have a whole video on 6 steps to breaking conditioned responses. Conditioned response could be movement triggering your pain or symptoms. So 6 steps to breaking conditioned responses. I'll put it to the top and down below. Lots is in that video. I outline really what I'm doing with clients and also what I cover in my digital course, the Somatic Safety Method. But movement here is medicine. It teaches our brain that we're actually safe to move. It teaches our brain that our body's not damaged. Movement also helps regulate the nervous system and process and release emotions. And so we need to move to improve. That rhymed. I didn't mean for that to, but we need to move to improve and do this gradually and slowly. And if you're having too much fear, like work with a practitioner that really can help you do this. Can be an essential part of a lot of people's healing. And lastly, number 9, leaning into pleasant sensations and experiences. This goes hand in hand with nervous system regulation. But for a lot of us, when we have chronic pain, chronic symptoms, a lot of difficult emotions taking place, our brain gets so wired to focus on everything that feels unpleasant within. Again, you're not to blame for this. This is what happens when we have so much unpleasantness going on inside. We just become wired to lock onto it, to obsess about it, to hyper focus on it. But part of healing, part of regulating the nervous system, part of living life more is starting to lean in, give ourselves permission to lean into pleasant sensations inside or neutral sensations and pleasant experiences in life. It is one of the best ways that we can cultivate safety within our body. And this could be even attending to things like sight, sound, taste, touch, smell. This could be attending to the sensations on the tip of your nose or the bottom of your feet or your toes. Focusing on exploring and teaching our brain to gravitate towards what feels nice inside and gravitate towards pleasant experiences in life. And doing this can actually have a real effect on reducing our chronic pain and symptoms. So I hope this video was helpful. Please put your questions or comments down below. Hit the like button, subscribe to my channel, and I'll talk to you all soon. Take care.